Good afternoon. Thank you so much for joining us. This is Menopause Matters, the economic impact of menopause. This is one of the events that is part of Illinois' inaugural Menopause Awareness Week. This is the first ever Menopause Awareness Week in Illinois, and we've been having events all week. We're so glad you could join us for today's. And we want to make sure to thank and recognize the University of Illinois Health, Women Employed, and the Lieutenant Governor's Office in putting this week's events together. We're so appreciative of the leadership of Illinois' Lieutenant Governor, Juliana Stratton. And on her behalf, we're going to hear from her Director of Policy for a moment, Nikki Giancola-Shanks. Nikki.
Hi, everyone. Thank you guys so much for hopping on and joining this informative webinar today. The Lieutenant Governor couldn't be here live with us, but she is very excited about all the work that's going into this week, and she wants everybody to know it's just the beginning. We have ideas, and we're working with our partners to try to create some new policies around menopause and menopause care. So stay tuned. And thank you guys all for joining.
Thanks so much, Nikki. We appreciate that. And again, appreciate Lieutenant Governor Stratton's leadership, as well as the leadership of the Illinois Council on Women and Girls, which she chairs and was instrumental in bringing Menopause Awareness Week to the forefront and this week's events as well. A few housekeeping notes. Your video is turned off and you will be muted for the duration of today's events. Um, all registrants will receive a link to the recording, and we really encourage you to share it with your networks. In fact, there are other webinars from Menopause Awareness Week that you will also have access to. And if you have questions during the presentation, please type them into the Q&A function. We won't be answering questions during the conversation, but we do have a Q&A session at the end, and we will be looking at the questions that come up. So at any point, you can put questions in the Q&A function. Just know that we're not going to be discussing them immediately, so that we have an opportunity here from our amazing panelists. Again, thank you for joining us today. My name is Sharmili Majmudar. I'm the Executive Vice President of Policy, Programs, and Research at Women Employed. Women Employed is a nonprofit organization based here in Illinois that focuses on advancing women's economic justice through employment, education, and entrepreneurship. And we're so excited to be hosting today's conversation looking at how menopause does intersect with work. I am joined by two fantastic guests who have been diving deep into the impact of menopause. Corinne Kodama, who's Senior Research Analyst at Women Employed, and Jennifer Gerson, who's a reporter at The 19th, which is an independent nonprofit newsroom reporting on gender, politics, policy, and power. We're going to put the bios in the chat so that we can make sure to make the most of our time together. And I am going to start us off by asking Corinne, you have led Women Employed's investigation of the workplace and economic needs of women 50 and over. So, can you share a little bit about what led to Women Employed embarking on that work and give us a high-level view of what you found?
Sure. Hello, everyone. Good afternoon. We were Women Employed, as you mentioned, works on economic justice for women. And what we've been seeing is that the numbers of older women in the workplace is growing. In fact, more than 1 out of 10 women, more than 1 out of 10 workers is a woman over 55. And so we were exploring, different, what do we know about these women? And one of the things that we found was that almost all the research or the information on older women was about retirement or health, not about the workplace. But we know that there's many women out there working as they get older. We also know that the gender wage gap grows larger as women get older. And we also know that many of these women have significant caregiving responsibilities, whether it's for their children, for their parents, or for other relatives. And this often coincides with sort of the peak earning years for a lot of women who are in leadership roles, between the ages of 40 and 60, for example. So, there's all of these things that are happening are going to interfere with their work. Another thing that we found in looking at the research and the information is that most of the information on older women really focused on sort of white collar professional women who work in offices. They're getting ready to retire and spend time with their grandchildren and travel and volunteer. And that's really not the case for a lot of women, particularly lower paid women. It could, women of color, and that's really the audience that Women Employed focus on. There's a little bit of research on older workers, particularly from AARP, that focuses on age discrimination. And they've actually found that age discrimination has been rising. And in fact, during the pandemic, 78% of older workers reported having seen or experienced age discrimination, which is the highest level since AARP began tracking this in 2003. So there's a lot of need for looking at the issues facing women in the workplace.
Thanks for that overview, Corinne. I'm going to ask you kind of to similarly give us an overview and kind of like how you got here, Jennifer. You recently launched a menopause newsletter at the 19th. I'm sure that the most recent issue on night sweats will be bedside reading, and we were just discussing weighted vests before we started. But can you share what led to you in the 19th authoring this newsletter?
I love talking about this because I think it's just really speaks to this moment we're in. I mean, the kind of real nuts and bolts origin story is there was a company-wide initiative to we were all in cross-departmental teams to pitch some new ideas for journalism we wanted to do in the upcoming year at our annual company retreat this past summer. And I was on a team that was tasked with developing a new newsletter. And pretty quickly we landed on it has to be about menopause. And the second I heard, I mean, it just seemed so obvious the second it was said, and there was so much excitement about it and excitement for the possibility of what that meant in terms of reaching folks. And I, have been covering politics and health for 20 years now. And what I really love about doing this work is I think we're especially in a moment where there's so much distrust in media, there's so much disinformation. This feels like such a huge opportunity to reach such a tremendous number of people. There's 1.3 million women in the United States who enter into menopause annually. To kind of cut through the noise, there's menopause coaches and influencers. There's so much content on Instagram. I'm in my 40s. I'm on Instagram. It's all I get from the algorithm. And I think we just really wanted to engage with people and say, okay, one thing we can do as journalists is give you some facts, and let's cut through that and let you know what we really do know and don't know, and help have that dialogue and, have conversation. I think it's a great trust building exercise too. And it's very personal. I'm in my early 40s. I have 2 children and I'm very sweaty at night. So I'm excited to get to talk about all of this.
So much, Jennifer. I definitely see the impact of that algorithm as well. And also, to what you said, kind of not needing to suffer in silence or suffer alone. So really excited about the newsletter. Um, Corinne, despite the fact that your work on menopause was part of examining the needs of women over the age of 50, the age range for when people are affected, just as Jennifer was talking about, affected by menopause is actually far larger. Can you help us understand why it isn't simply an quote unquote older women's issue?
Sure. Yeah. Women experience menopause at all different ages. I mean, I think we typically think of people over 50, but actually it's much earlier that for a lot of people. Also, what is called perimenopause is for, when symptoms start. Sometimes those symptoms are actually, for some women, are even stronger for when they're in full menopause, and that can start easily in someone's early 30s. Also, there are different medical conditions or other reasons where they call it like induced menopause. So there might be certain health conditions or like cancer treatments or things, gender transitioning. If someone gets a hysterectomy, all of those things can cause menopause at any age, depending on when those things happen to you.
So let's stick with you for a moment, Corinne, because so that's, we're talking about decades in terms of the span that someone may be impacted by menopause. So can we dive a little bit deeper then into the workplace piece? And can you share what you found about how women in the workplace are impacted by menopause?
Sure. You mentioned some statistics earlier about how many women, feel like they need to change their job or leave their job or reduce their work hours. I think the challenge really in understanding how it affects women is that every woman's menopause is different. So as we said, it could happen to anywhere from your 30s through your 50s. It happens differently for women of color. And also, similarly for work, it kind of depends what job you have. So, if you have a professional white collar job where you have flexibility in your hours or you have a lot of great benefits, it's different than if you are a frontline worker that's hourly, that doesn't have an HR office where you have to wear uniforms. So the physical symptoms differ widely, but they can interfere with, being able to fully engage at work. So such as hot flashes, brain fog, headaches, sleep difficulty is a very common one. And all of these are treatable generally with medical intervention. But what happens is many women at work are embarrassed to talk about it or are either embarrassed about it or they're worried about experiencing ageism in the workplace. So they kind of, as you mentioned earlier, just kind of suffer in silence. So they might be less engaged at work. They might withdraw from others. They may take time off without telling people why they're taking time off. And they might, forego promotions or different assignments, or as you mentioned previously, they might leave the workplace altogether. And that's really a challenge because as we mentioned previously, women in this age group are usually near the peak of their career. They're in leadership roles. They have a lot of expertise and wisdom to share. And so when we lose them, we lose a lot of talent in the workplace. Also, when older workers in general, but older women leave the workforce, they tend to be unemployed longer than other people who leave the workforce. And it's harder for them to kind of get back in where they left.
So yeah, I think that it's interesting because you talk about the symptoms being incredibly disruptive, also treatable, but then there are barriers to those kind of accessing those treatments. And there's we'll talk a little bit more about other kind of issues when it comes to addressing menopause. But the fact that it's treatable doesn't mean that people aren't still impacted, right, by menopause. It's like it's not treatable does not necessarily mean it's like 100% solution. Um, and to your point, about what was it? In a recent survey, 1/3 of working women said that the symptoms actually impacted negatively their working performance and lowered their confidence and made some people want to leave the workforce entirely. And I think one thing that's really important to lift up here is that 70% of the respondents to the survey said that they have considered at least one type of major employment-based change due to menopause. So I think it just underlines what you're sharing about the impacts that it has and that they're serious. And I guess I raised that because there's a way in which we minimize the symptoms of menopause, but the reality of what people are going through is much more disruptive. So we did a series of interviews at Women Employed with women that really echoed what you're talking about, Corinne. So that, women who said it's been helpful to have a flexible working environment. It's been helpful to have remote work, being able to turn the camera off if I'm having a serious hot flash. Um, one woman we talked to was wearing a headset as part of her job and got the hot flash or the sweat was really affecting her ability to wear that headset because it became very irritating. She fortunately had a very supportive employer who switched her to a traditional phone, so that she didn't have to experience that kind of irritation. So, Jennifer, you've been talking to um, so many people, um, readers of the newsletter, people that you're interviewing. Uh, what are you hearing? And can you give an example of how these workplace issues are playing out rather for your readers?
Sure. Well, I would say to start that this is just super real. Like this isn't, as everybody has stressed so far, these aren't just symptoms. Like it's not like, oh, I feel a little hot, whatever. These are real things affecting people, especially these vasomotor symptoms, things like hot flashes, night sweats, brain fog that comes as a result of sleep disruption from these other things. They really have a real impact on people's health and well-being and ability to participate in the workforce and participate in their day-to-day lives. This is something that I just hear from everyone I speak to. It's not just, oh, this is something you're going through, whatever, you'll be fine in a day. It lasts for, quite a number of years. The average age of menopause onset in the United States is 51. Perimenopause on average in the United States starts 10 years prior to that. We're looking at 41. Symptoms typically last anywhere from 5 to 10 years, depending on, we see a lot of disparities with race. That's a lot of time. That's a lot of time to be seriously impacted by things. So I think that's the first thing to just say is this is real. And we have to keep saying it out loud because we are still, as much as menopause is being discussed, we are still in a place where there's so much dismissal of these symptoms. I think the other really big part of when we talk about the workplace is talking about mental health. Something I talked about in our kind of debut edition of the newsletter. And just resonated with me so much. And it's something I feel like I just keep hearing as I talk to more and more people, how because of the hormonal changes during this period too, people are, as my 10-year-old would say, crashing out. I mean, they are getting to this phase of life and they are really feeling it. And I think we have to have a really robust, open, and honest conversation about what that means and what that means for our economy, frankly. I think that something that has come up too is that it's not just okay, this is happening to people, their mental health is suffering because of these symptoms in this decade. It's kind of also the result of decades of having symptoms dismissed that are associated with their reproductive health and the toll that takes on your mental health. And it just all starts to come to a head at this phase of life. We think about if you were someone who had a difficult period and we're told, oh, whatever, just cramps, like deal with it. If you we're having a difficult time postpartum after having a child and we're saying, oh, it's just the baby blues, deal with it. You have decades of internalizing that the real symptoms you're feeling aren't real and don't matter. And then you get to this time of just tremendous hormonal change and like what happens? And it's real. And I think that when we are thinking about what is happening at work, we have to talk about how people are feeling this. When I talked to Dr. Harita Raja for this first edition, who's a psychiatrist, who's a menopause certified practitioner through the Menopause Society, is something she talked about. She's like, these are women who have spent decades being told what they're feeling isn't real, and then there's just too much change to ignore anymore. And she said something she sees a lot in her practice is women keeping it together at work because that's where they have to keep it together because there are so many people in the workplace dependent on them and that their families are dependent on their salaries too. And then they come home and are falling apart and are really hitting rock bottom and in a dark place personally because they have to be together professionally. And I think we just need to keep having that conversation. And I think just to shift slightly in terms of symptoms too, I think we have to talk about the impact of lack of sleep, which is something I hear a lot about in terms of what the real effects are of hot flashes and night sweats. Like I got up at 4:30 because I was sweaty. I definitely feel tired. I loved an analogy someone said to me once was, well, how did you feel when you first had a baby and you were not sleeping at night for the first few months? And I remember I was like, well, felt like hardly functional. I said, well, extend that for 10 years. Like, how would you feel? And that's what so many people are going through. And we need to name it, we need to address it, and we need to think about what does it mean to show up at work every day if you aren't sleeping through the night and the real toll that can take on your ability to perform. It's something I definitely have heard about from readers and who, like we've mentioned here today too, are having trouble accessing healthcare providers who can help them get the kinds of treatments they need to address those symptoms. I had a reader write in and say, I live in a rural area. I can't get to a menopause certified doctor. Like, what do I do? So I think right now we're in a phase of, I think, this conversation that's really identifying problems because there's lots of them. And we have to keep doing that to start even thinking about what the solutions are because it's so many people impacted in a really real way.
Yeah, thank you for that. I think you've, really helped us think about this in a broader context, like in the context of women's health overall and how many women have felt like gaslit by the healthcare, by their healthcare providers for years, far beyond menopause. But then also things like what's actually covered by insurance. So it's such a range of ways in which we need to be talking about this. Corinne, I think as Jennifer has so well stated, menopause is real, but it's also a natural transition. And there's a significant portion of the workforce that's experiencing it. So if we shift the focus a little bit more now and talk about employers, like how can employers support their employees going through menopause?
One of the things that we've heard from the people that we talk to, as well as what I've seen in the research, and is that what the best thing that employers could do is really to be open about it and normalize menopause as, like you said, part of just life. It's real. It happens. It happens to people at a certain age. They're not making it up. Just like, 20 years ago, you couldn't talk about pregnancy in the workplace. It's a similar kind of thing. Like it's the same kind of thing. It's related, like Jennifer was saying, to women's health issues that often have been dismissed or seen as sort of extra or personal or whatever, but it is a real health issue. And if workplaces care about the health and well-being of their employees, menopause is just part of that conversation, just as pregnancy would be or anything else. So the best thing that employers could do is really to just normalize it with everyone, not only talk to women about it, talk to managers about it so that managers are informed, that they can be approachable. Some of the women we talked to said what was most helpful was knowing they could talk to their manager. And one of them mentioned specifically that it was a man, and he was very open about talking about it. And that was really helpful for her because otherwise she would not have gone to him to ask for help. And then there's different ways that employers can support people experiencing menopause through benefits. So there are, creating menopause specific benefits and sort of assessing where your benefits fall. Like, there are this mostly is larger companies though that, will hire consultants, or there's targeted resources for people experiencing menopause or particular health coverage, things like that. But many existing benefits that workers already have can be used for menopause, but that's not always clear because it's not talked about. So explicitly mentioning menopause as something that you can use sick leave for or paid leave for, or if you have access to like an employee assistance program, that you can access that to help you manage some of your experiences with menopause at work. If you have a flexible spending account or a health savings account, just kind of being clear with everyone on, these are benefits that, just like we say, this can be used if you are sick or you need to take your kid to the doctor, or if you are experiencing menopause, right? To just be more kind of explicit about that, because there's been a couple studies that have showed that employers said that they offer menopause benefits or benefits of use for menopause, but only about a third of employees thought that they did. So there's like this disconnect between what's actually out there, but what employees don't realize can be used for menopause. So employers need to be more explicit and more, open about these are things that can be used for menopause, whether it's in a benefits booklet, whether it's in newsletters, whether it's, staff meetings, anything like that, so that people know, because more than half of the women who have access to menopause benefits say it positively impacts their work. And a significant portion said also it improves their ability to get promoted. So this is important. Women want these benefits at work, and some of them have those benefits and they don't even really know it.
Thanks. I think that's really important because people may not be thinking about the options that they do have, and then just like we talked about before, suffering in silence necessarily. Um, I'm curious though, Jennifer, like the experience of menopause is, while there are these like groups of symptoms, right, that are very similar. So, hot flashes is an example, brain fog is another example, sleep disturbances. The degree, the severity, the frequency of that really varies across people. And there are also a whole host of other symptoms that we haven't even mentioned that some people might experience. So they can be like very debilitating for some people and maybe less debilitating for others. It can last different like amounts of time. So given the variation, can you share, like, have you heard of any particularly innovative or creative ways that employers have been supporting their employees, or frankly, even just empathic ways, right? Where they're responding. Like I'm thinking about the person who spoke to us and whose employer switched out her phone for her to make her more comfortable.
I think I'm going to switch gears slightly and go back to my roots of being a political reporter. And I think actually what's really interesting that's happening right now is just the amount of momentum we are seeing in state houses on legislative solutions to kind of address some of this. Because I think I will always believe that kind of culture and politics are forever intermingled and operating hand in hand. And I think that what we are seeing happening politically is going to have a huge impact on what we are seeing in terms of how employers are responding. And obviously, you all in Illinois know that probably better than anyone, because that's why we're sitting here right now. And I think it's just really important to call attention to that. We talked about what's happened in Rhode Island, how this summer the Menopause Workplace Protection Act went into effect. It was the first state in the nation to mandate workplace accommodations for employees, experiencing menopause symptoms. And I think when people hear this, their knee-jerk reaction is, well, what do these accommodations even look like? And as you pointed out, it can be something as simple as headset for a phone. But it's also, again, these modified schedules, additional breaks, access to a fan, being able to control the temperature in your office. I think it's all stuff that when you hear it, you think, oh, this just makes so much sense. I think it's so much more tangible and practical than we even think it can be. And I think the momentum we're seeing around legislation like this is so important. And something else that I think is really significant about the bill is how that Rhode Island bill baked in this confidentiality and non-discrimination into what that legislation entitles. Because I think something we do hear so much about, which we've touched on today too, is ageism, which is super real in the workplace. There was a lot of reporting this summer on this concept of like the power pause of women who are kind of at the peaks of their careers in their 40s and 50s, stepping away from the workplace because these symptoms, and a lot of it has to do with these symptoms and the mental health dynamic just being too much. And I think by baking in that your employer is going to keep this information confidential and not discriminate against you, I think that has a huge cultural impact on how we're even able to think about what do these accommodations look like. So I definitely wanted to flag that too. And I think there's just, again, there's some real momentum here. We've seen over 20 bills focused on menopause in some capacity, introduced in, I think, 15 states and counting so far for 2025. There's real momentum here. It is really bipartisan, like this is popping up in red states and blue states and purple states. This is something I think we're seeing that, we live in a really divisive political climate. This is something everyone is really getting behind because I think they know they have to. It's so many folks who are impacted and are looking for help right now. And I think the fact that we're seeing politicians responding speaks volumes. They know they have to do something to reach their voters and to address the really, really serious needs they have. We're thinking effectively about 1 in 4 states in this country saying, okay, let's do something. And I think we're just at this really big inflection point where everyone realizes that everyone is talking about this right now, and that it's time to start being a little more innovative in terms of thinking about solutions from a government perspective, because that's the first step for seeing some downstream cultural change.
Thanks for that, Jennifer. I think part of what we also need to talk about is something that Corinne, you alluded to a little bit earlier, which is that potentially the legislation, although legislation is really helpful at kind of, setting a standard, right? Setting a floor. Um, but when we talk about workplace supports, there are a number of companies now that have arisen to match that momentum that you're talking about, Jennifer, that provide menopause-related services for large corporations or that kind of thing. And that's how employers are responding to the needs. But a lot of those workplace supports don't necessarily, or they presume a particular kind of job, right? And, you know, at Women Employed, we're focused on women in the workplace, period. And particularly those who are kind of most vulnerable or who may not have the most access to job quality, job benefits, et cetera. So given everything that we've already talked about so far, Corinne, I'm wondering kind of what you think is missing in the discourse, or perhaps even more specifically, like who is missing? What are the disparities that we need to make sure we're paying attention to?
Yes, I think the primary one, like you just alluded to, is, the difference between people who have office jobs and flexible schedules and those that don't. So people that are, public facing in frontline jobs that have that are hourly, that have very specific shifts where they have to be there in person. There is no flexibility for their schedule. They have to wear uniforms that might be challenging for people experiencing hot flashes. There isn't like just an HR office you can go to ask for accommodations. A lot of workers, there are a lot of older women workers in these jobs that are hourly or part-time that don't have benefits like paid leave. And so there's just a huge gap in addressing, how do we address the experiences of these women who are not able to access a lot of these other things that are more commonly talked about, in terms of kind of office accommodations and things like that.
And I'll put this to both of you actually, because you raised it, Jennifer, but I know that part of your research, Corinne, has been about kind of like the landscape around this. Um, so what is happening as it relates, like let's dig a little bit deeper. What is happening as it relates to menopause laws and menopause policies? And are there any types of public policies that are being discussed that are that kind of speak to the breadth of what we were talking about, right? Like the fact that there's a need for research and there's a need for medical certification and there's a need for flexibility in terms of time off. Can either of you or both of you speak to that?
What I found is the legislations tend to fall in a couple different areas. One of the biggest ones is about medical training and certification, because so many health providers are not educated on menopause. It's not something that's often taught in medical school, and they don't know how to deal with it when, often a good chunk of their patients are experiencing menopause. So there's been a few states that have proposed bills that are some variation of requiring menopause training, either at the get-go or for recertification. For continuing education credits, or even just more basic, just requiring health care providers to provide information about menopause to patients, maybe even if they haven't had all this training. So that's kind of one area. Another area is around insurance and requiring or mandating insurance to pay for different types of menopause treatment. And that can be a whole range. So I'm not going to go into the details of that. And that includes if induced by hysterectomy, for example, which Illinois does have a law for that specifically. And then another big one, which is something that Women Employed works on a lot, is paid leave. So paid family and medical leave, which can be, is considered for longer term leave more than just like a couple of sick days. Because for some people, menopause is an ongoing chronic type of situation where they may need more time off than just a couple of 6 days that you might have. So paid family medical leave can often be taken for a variety of health and personal situations, right? Including menopause. So paid leave is a big one that most states do not have in the way that would be useful for menopause at the moment. So that's another one that I would mention that is probably a really big one that's just not happening yet.
Jennifer, any additional thoughts as it relates to the trends and what you're seeing in terms of public policy?
Yeah, I mean, those are definitely the three major buckets. And I think there's, I think, a lot of chatter right now, especially on this kind of education and training one for providers. We're seeing, I think, a kind of cluster of bills popping up in a few different places around that specifically. And I think, again, that really speaks to something that has come up so many times that people cannot access healthcare. And again, when we think about who is most impacted, how disparities sometimes compound, I think that is such a critical component of that. If people I think we think about people, I think we forget sometimes the degree to which healthcare access impacts employment and that these things really, really go hand in hand. And we know, right, there's so much research, which I know that you all talk about on people, people don't go to the doctor because they can't take days off of work. It doesn't fit with their work schedule, things like that, or they simply don't know how to access a doctor. Like there's not a qualified provider or a culturally sensitive provider in their community who can help them. I mean, we think about how huge this issue is. I mean, I was speaking to a woman earlier today, a reader who, lives in suburban DC with an affluent white woman. And she even spoke about the fact of how hard it was for her to find a trained menopause certified gynecologist. And she was saying, she was like, if it was hard for me and it took me months to find someone and I had to drive an hour, like, what does that mean for other people? And I think that is a really important conversation to be having. And I think the fact that we're seeing this push of bills focus on education, especially, is again an important part of this conversation and something that is definitely complementary to what we're seeing on the side of the insurance coverage, the workplace accommodations, those kinds of protections, because without the training, without being able to access a doctor who can help you, we're still kind of leaving people to just grin and bear it and figure things out and kind of hope for the best. And there's so much research to connecting a lot of these symptoms, especially these symptoms like hot flashes and night sweats, to long-term cardiovascular health issues, which are really, really especially pronounced in like Black women. And I think we need to talk about who gets to go to the doctor and what it means if you don't, during this phase of life, get to attend to those symptoms, what impacts down the road when you are in later age, when you are past middle age, what that's going to mean for your healthcare. And I think some of these bills are really starting to maybe think about what that means.
Yeah, I think the health care access issue is so important, particularly in this moment where we're hearing particularly rural providers or hospitals are, potentially closing with the cuts in funding for healthcare, all the changes and reductions as it relates to Medicaid. It's really going to have an impact on healthcare access, period. But also more specifically to those who were perhaps a lot more isolated from having a accessible healthcare home already. And then we also think about health insurance and health insurance costs going up as well. So it's coverage, but it's also cost in addition. I'm wondering if you can, Jennifer, just follow up on a comment that you made, and just to, I think, punctuate this point that there are very significant differences in how women experience and people who experience menopause experience it across kind of like racial and ethnic backgrounds. And that I think is also a piece of the research and access to healthcare and access to accommodations and all of those things. Can you say a little bit more about that?
Yeah, I think it's really important to talk about this, and it's really important to talk about the fact that there's a ton we simply do not know because the research has not been there. And we do know that Black women associate symptoms, especially these vasomotor symptoms, hot flashes, night sweats, for longer durations of time than any other demographic. Hispanic women are the group second most impacted, and then white women are third. Again, we're looking at maybe 5 to 7 years for white women in terms of experiencing these symptoms, and usually closer to 9 to 10 years for Black women. That's a big difference. And the really interesting thing is when you start to talk to clinicians, to research, and say, well, why is this? The answer is we don't know. I've heard that so many times. And there just has not been the investment in medical research to kind of get to the why of that. But the differences are very pronounced. And yeah, I was actually just speaking recently for a future edition with Tanae Lewis, who is a really wonderful epidemiologist at Emory University's Rollins School of Health in Atlanta. And she studies how, the different kind of the societal factors, especially in terms of discrimination, impact middle-aged women, middle-aged Black women's long-term health outcomes, especially in terms of cardiovascular health. And she was talking about this. She was like, we know that these symptoms are attributed to higher rates of cardiovascular disease later in life. We don't know why this demographic, why we're seeing more heart attacks in Black women at younger ages. We don't know why we're seeing prolonged symptoms of Black women experiencing menopause. We still don't have these answers, and we can't think about people's not just like lifespan, but health span until we have the research to address these issues because these are people in this age bracket. This is who is taking care of our society. These are people who are caring for aging parents, caring for children, who are community volunteers and participating in the workforce. It's just touching when we think about the economic impact, it's certainly touching everything because this is again, just absolutely tremendous number of women. And there are certain women who are really disproportionately suffering from symptoms with real outcomes, and we do not have the answers as to why yet.
Yeah, that really doubles down on the need for more research. I know that at a previous Menopause Awareness Week event earlier this week, I believe that the stat that was cited from Dr. Pauline Mackey um, was 27 incidences a day of hot flashes or vasomotor symptoms for Black women. And that is 27 times. It lasts a few minutes every time. And it's not as simple as, oh, I'm a little uncomfortable. It's much more disruptive at times than that. And there was a real difference kind of for the Black women patients that Dr. Mackey was talking about. So it seems like that would be something that would be really helpful to learn more about. But I think that also kind of tells us about, and you alluded to this, Jennifer, there are economic costs that go beyond the workplace, right? We've focused on the workplace. We've talked a little bit about workplace policy and workplace accommodations, but can you share a little bit more about what the other economic costs are that you're seeing related to menopause?
It's all of these other things. I mean, I think walk out the door and look any way, and you're going to see the answer to to that question. I mean, again, this is people who are impacted by perimenopause and menopause sandwich generation folks, right? They are people who are caring for aging parents. They're people who are caring for young children. They're the people who are running the school fundraisers and, volunteering at field day. They are the ones volunteering at different organizations in their community, showing up and supporting. I mean, our neighborhoods are held together by women often who are of this phase of life and are also suffering from real symptoms and are, if they are unable to participate and do these things, it's like pick which thing starts to fall apart first. And the answer is probably all of them. And Dr. Lewis, who I was just mentioning at Emory, she's doing some research on what she calls cost of caring stressors and the impact those stressors have on middle-aged Black women's cardiovascular health. And she was saying, and what she has found in her research is the primary forms of stress that these women experience don't have to do with stress they personally are experiencing. It's not because they're going through something hard at work or they're even feeling stressed out about their own healthcare. It's the weight of caring for so many other people, and it takes a real toll on people's health, which then in turn impacts everything because she had said too, she was like, she heard a sociologist say recently, she was like, other countries have social safety nets, but the US has women. And I think we have to think really holistically about these economic impacts because if you're saying, again, we talked about earlier, 1.3 million women a year entering into menopause in the United States per year. So we're thinking of people experiencing these symptoms. What are all the things they're not able to show up to do? And who are the people they are showing up and supporting that are feeling the impact of their inability to participate in full? It's the economic impacts like just don't end. And I think that is huge.
The other
I think
thing I would
also,
say,
oh,
oh, go
go
ahead.
ahead, Maureen. Go ahead.
The other thing I was going to say is that, I think because of the shame and the stigma and the embarrassment that women don't ask for help, as well as the fact that a lot of medical professionals aren't trained to adequately deal with this, a lot of women, seek their own answers for, these symptoms or health issues and relief that either they don't feel comfortable asking a provider or they can't find a provider that knows how to help them. And menopause is big business these days. There's a menopause ad company for everything right now. Like I've noticed there's a lot of these Weight Watchers specifically for menopause ads that I've seen lately. I mean, it's a big business. And so a lot of women are spending out of pocket for supplements, treatments, different things that may or may not work. While there are things that do work, if you have a medical professional who can, prescribe that for you or that understands menopause, but there's a lot of supplements, programs, all these things out there that charge big money, for women and who, want relief from their symptoms. So they will spend that money, maybe for things that aren't effective or could have been covered by their insurance or things like that if they haven't been able to talk to a trained medical professional about.
I also think about, to your point, Corinne, employers who are thinking about how to support employees or employees who are thinking about how to get employers to support them, even as like legislation is moving forward and that kind of thing. Like it really is about listening to what your employee needs. And it might be that they need a couple of fans. Like it doesn't have to be a large dramatic kind of shift for an organization. Um, I think one of the people we interviewed said that the wellness room that they had in the office that they used for nursing parents to be able to express milk as required by law. That those wellness rooms could also be used as a place that people could cool down and have some extra fans there or can like rest for a moment as well. So there are ways that employers, right, can be creative through listening to what it is that people need. We've got a number of questions in the Q&A, so I'm going to just hop over to that. One question was about how menopause is experienced differently by women of color. And we talked about specifically the vasomotor symptoms, but is there anything else that we can add that helps to illuminate how how menopause might be experienced differently?
That's
I'll
sort of
throw
the
that to both of you.
I would say that's what we, I think, know the most about. That's where we see sometimes the biggest, I think, differences when we're talking about symptoms. But again, the answer kind of is always still that we need so much more research on so many other things. And there's so many other things that people are self-reporting as symptoms, but we actually still just don't have medical research on. I have an upcoming issue on ADHD and menopause, which is something that is all over my algorithm. I feel like I cannot open my phone without being hit with some content of, or you are in perimenopause, you probably also found out you have ADHD. And a lot of people are trying to explore some racial disparities in that. But the answer is we haven't studied the brain during menopause enough to kind of really break down what is happening chemically, how estrogen is impacting things. There's a lot of great scientists with a lot of great hypotheses right now, but we still don't have the information. So I think in terms of what we do know is we do know that there's a lot of disparity with these vasomotor symptoms. And then I think there's a lot of question marks. There's a lot of anecdotal evidence, but we hopefully we'll see some scientists designing some studies. We're going to be a while out from some answers, but we need to start to do a better job of identifying how things are playing out with different racial groups to really be able to get people the care they need.
I think, and I'd be remiss if I didn't highlight that in Illinois, and kind of like one of our co-presenters of Menopause Awareness Week is University of Illinois Health, and they have just launched a brand new Center for Health Awareness and Research in Menopause, CHARM. And they're going to be addressing gaps in medical training, but also in research and in global data, so that we're kind of understanding the experience, because it's not an American issue, right? In terms of the gaps related to research and supports and that kind of thing. They're across the country. One other person asked about considering Illinois a disability. Like it's not just in Illinois. I think it would be helpful to hear this. Um, Considering menopause a disability in order for people to access accommodations, or perhaps even access leave if it was kind of like a particularly, I think, intense and disabling experience. Have either of you come across that or heard anything specifically about considering menopause a short-term disability?
Yes, I have seen that. I actually know someone who has done that. I think it just really depends on your situation and your coverage and your employer. I think it depends on a lot of things. Um, I think that is an area that's not always clear, or maybe not always, like the person I know that did that. She had a difficult time getting that approved as a disability, as menopause wasn't mentioned specifically in their policy. So, that's another example of what does your policy cover or not. So, yes, I have seen that, but, we're not here to offer advice about what's the best thing for you to do, because I think it really does depend on your situation, on your actual policy, on your employer, and all of those things. But that is one way. I mean, just like sometimes women will take disability for pregnancy. I mean, it's a similar kind of thing, right? Like if you don't have other options, it may be something that might work for you.
I mean, I think again, with this intersection of health and well-being and work and menopause, one other question brings up this issue of insurance coverage for hormone replacement therapy, and asks kind of how can we do better about getting equal coverage? So what kinds of advocacy is possible with employers to and with employers and with health insurance companies to get that kind of treatment covered? I'm wondering, Jennifer, if you're seeing that show up, like the advocacy specifically with insurance companies on coverage.
I think the interesting thing there is even kind of taking a step back and just how I mean, there are obviously some FDA approved medical treatments for menopause symptoms, but on the spectrum of things that, we think of having FDA approved treatments, it's a pretty limited number. I mean, there's a lot fewer treatments that even exist that are FDA approved currently. So I think we're once again kind of in this place where the culture and the research are in this moment of disconnect. There's, a lot, we're in the midst of, we're finding out whether the FDA is going to change, the labeling of estrogen and hormone therapy, whether it's going to still have a black box warning or not. There's, still not an FDA approved, I think, testosterone treatment for women experiencing some of the sexual side effects. We're kind of still in a place of a lot of flux in terms of even approved treatments. So I think where like things are right now is still a lot of conversation, and I think a lot of momentum from healthcare providers, frankly, in trying to push for more FDA approval to see more drugs approved so that this conversation about coverage can even begin. Because right now, I think that's really where people are feeling so much of that tension point. But the problem is it's expensive. I mean, I was just talking to someone earlier today who was saying she was finally able to find a provider who was able to prescribe hormones, and her insurance wouldn't cover it. It was going to be close to $300 a month out of pocket for that expense. And she was like, how is that tenable? She's like, so I had to stop taking it. That wasn't a tenable thing for me to do. And it's a real thing. I mean, and she's not the only person I've spoken to who has a story like that. People are really feeling the cost, and we really need to talk about this cost again when we talk about this economic impact. That's a lot of money. And so I think there's still so many barriers to even accessing a lot of these medical treatments that I think people are slowly learning about the cost because they're still overcoming the barrier of accessing prescriptions. But I think as there's more and more conversation, we're going to see more momentum in that space too.
And,
There's also a place. Go ahead, Corinne.
This is why it's important to talk about menopause at your workplace and to be comfortable doing that. So you can write your benefits person or your HR person and say, hey, it doesn't look like we cover this. Could we consider covering this, right? That our plan doesn't do this. I mean, you can always, you have to be your best advocate and, asking for what you want. And you can also email your electeds and, related to any statewide legislation that you would like to see related to menopause that you can do. And the more that they hear from people, the more they're going to start paying attention.
Yeah, I love, Corinne, that you added it and ended in a call to action. We could talk so much longer. I encourage you all to sign up for Jennifer's newsletter through the 19th, so that you can continue to be part of this community conversation. You can also sign up for Women Employed's newsletter and hear more about what we're doing related to policy programs and research in employment, education, and entrepreneurship. I will say, because a number of people in the Q&A did ask questions about finding a provider or difficulty finding a provider. If you go to menopause.org, you can find a practitioner by zip code. We still have a long way to go to get it more practitioners certified, but that is one place that you can start. And the Charm Center that I mentioned in Peoria will begin taking patients in January. So definitely look out for that. And I remind you, all of the webinars, and there's a webinar tomorrow that's focused on nutrition and menopause. There was a webinar earlier this week that was also focused on just the medical experience of menopause. There's a lot of content that you will still have access to, I promise, after Menopause Awareness Week is done. And I want to end with thanking Corinne Kodama and Jennifer Gerson for being part of this conversation today and sharing your wisdom and insights. And I certainly hope that you all will join us for next year's Menopause Awareness Week, because I'm sure there's going to be lots for us to talk about then as well. Thank you to the Lieutenant General's team and the Women Employed team for today's event. And we will see you soon. Take good care, everybody.